You are listening to the IN-CJ podcast, Conversations about International Criminal Justice.
All right. Would you like to start, Pia, by introducing yourself and the topics?
Yes. So, hello, everyone. I'm very honored to be here with you today. My name is Pia Puolakka. I'm a senior specialist and team leader in the Finnish Prison and Probation Service. I've worked as a project manager for some digitalization projects, one of which we will present today. And I'm also involved in projects regarding the use of artificial intelligence for offender management and treatment. I'm also a member of the Europris ICT expert group and part of the Council of Europe's Council for Penological Cooperation expert group. And by education, I'm a forensic psychologist, and today with my colleague, who will introduce herself soon, we will present how we use virtual reality in rehabilitation in Finnish prisons.
Okay, I'm Jenni Kaunomäki. I'm a forensic psychologist. Currently, I work in the psychiatric hospital for prisoners. Before this, I have been working in a couple of other forensic hospitals for the last 8 years, I think, mainly with patients who are not criminally responsible due to mental illness and who are in involuntary psychiatric care. But right now in the psychiatric hospital for prisoners, we have patients who are in voluntary care and also patients who are here to, by court order, that we do some assessments with them. They're usually for criminal responsibility or some violence risk assessment or sexual violence risk assessment for prisoners who are in the release process or are going to move on parole. So a big part of my work is actually assessing people and also psychological interventions for prisoners with conduct disorder or problems with impulsivity or violence and things like that. So assessment and interventions, a combination. I'm also a PhD student at the University of Helsinki, and that's the study I'm about to present shortly. It's about compassion-focused therapy and virtual reality, and how we can use that or that combination in rehabilitation of the juvenile offenders who have conduct disorder or and callous and unemotional traits. So this is quite interesting study project, which is in its early phases, but I'm interested in telling you about what we have so far, what are our plans. But Pia, you promised to tell us about the Finnish Smart Prison project, isn't it? So would we start from there?
Yes, we can start from there. And actually, I try to share my screen. And actually, I think I will tell you about the Smart Prison project, of course, but let me see. So we had a project called Smart Prison Project during the COVID, I could say. So we started in 2018 with the idea that we are going to digitalize Finnish prisons and bring more digital services to be used directly from the cell. And even if COVID was very hard times for prisons, I think it speeded up a lot the use of digital services. So it was kind of a benefit also for our project that we had to do it during the pandemic. And we provided in-cell devices for a new women's prison. And now we are actually extending this in-cell device model to all our closed units, which means that inmates can use a laptop and a kind of prison intranet for communication, and to a limited extent communication to outside via video calls and use of restricted internet connection. And also part of this new women's prison project, we decided to start a virtual reality assisted rehabilitation pilot in 3 prisons. And in these prisons, the prison psychologists were mainly responsible to assist these sessions with inmates. And the purposes we had with the project were to help inmates with their self-management and relaxation, relieving withdrawal symptoms in substance abuse rehabilitation wards, also some skills training and exposure therapy to help with anxiety disorders and panic attacks and phobias. And we didn't actually do much of a research, but we gathered structured feedback. And we were collaborating with the Tampere University and Helsinki University Hospital, who provided us these virtual reality programs. And the first one was a kind of a virtual forest by Tampere University. And we wanted to test whether it can enhance prisoners' psychological well-being and restoration, and also compare the benefits of real nature versus virtual nature. Some prisoners stay in very restrictive and isolated conditions. So, for example, due to security or psychological reasons. So we wanted to provide them something different also, and a way to get a taste of real nature, but in a virtual form. Prison as an environment, as you know, is quite harsh, requires massive adaptive resources in order to manage, and can be very restrictive, hostile, and abnormal environment. And inmates in general have poor self-regulation skills, mental health problems, and they use addictions and aggression instead of adaptive self-regulation. So the idea was to try to support adaptive self-regulation. And here is a screenshot of the virtual nature we used with the inmates. Then we had we also collaborated with Helsinki University Hospital. They had VR programs that were originally intended to patients with psychotic disorders, paranoid and intrusive thoughts in social situations. But we concluded that since inmates also have social anxiety, social cognition disorders, panic disorders, they would benefit from this kind of therapy. Exposure therapy to different everyday situations, which are hard to train in closed prison environment and in isolation, where they more easily aggravate also their anxieties and phobias. And we were provided a little treatment manual from the Helsinki University Hospital. And then we started to test. Here is a test picture of having a metro travel, which can be very disturbing to some with serious anxiety and social situations, phobias. And as we know, addictions and drug use are often related to alleviate symptoms of anxiety, for example. Then the latest one is a skills training pilot with a company called Virtual Dawn. They provide programs to train everyday situations management and phobia treatment. For example, visit to social office, job interview, responding to feedback, and phobia management of different situations. And we are testing this with especially young prisoners and prisoners also in vocational basic skills training. And we, of course, try to gather feedback. Here is a picture of the one of the Virtual Dawn simulations. Then the one that Jenni will talk about, I don't go into details now. This is a very interesting research project Jenni is starting. It's a compassion-focused therapy combined with virtual reality intervention for young offenders with antisocial threats. And we were lucky to be collaborating with ex-prisoners who have been involved in making these virtual environments where you can test your management skills in aggression-provoking situations. Jenni will talk more about that. Our preliminary feedback is positive and promising. We want to continue. And we know from previous academic research that this can actually work. It can alleviate many symptoms, starting from anxiety, PTSD, psychotic disorders. It can increase restoration, have positive impact on many skills, and also alleviate and help with anger issues and aggression. Here is a little link to a Business Insider document that was made of our project. Maybe you can get it later after this live session today. If you are not aware of, in Europe, we have a Forever Forum for people who are interested in conducting research on virtual reality treatment in forensic settings specifically. You can find us also in LinkedIn. Some references you can check later, but now I will hand the presentation for Jenni at this point. Thank you.
Okay, so about the study project that I'm currently working in, it's a rehabilitation project, as Pia said, for young offenders and youngs, juveniles from reform schools who have callous and unemotional traits and who are impulsive and who have conduct disorder. So quite nice bunch of youngsters who have learned not so nice ways to survive in this world, but we're trying to recruit juveniles who are from 15 to 20 years old and give them virtual reality assisted compassion focused therapy to see if it has some effect on the callous and emotional traits and on the conduct disorder. If we could increase some compassion towards themselves and towards others, and see if that affects the way that they behave. But first, to give you some context about this Finnish criminal sanction system and in reform schools system in Finland, because we have this reform school system that is part of the child welfare system and not the juridical system. It's kind of out of home care and elementary school combined for juveniles who have severe problems, mainly of school problems or conduct disorder or problems with substance use or criminality. And they may be placed in reform school to make sure that they have that kind of rehabilitation that they need. So in reform schools, we have children who are under 18 years old. But then we also have the criminal liability age, which is 15 years old. So if a young people conducts a crime and is sentenced to prison, we also have these juveniles in prisons who are placed in separate units than adults. So we have about 70 beds for young offenders who are under 18 years old or so underage, or young offenders who are under 21 years old. So or everyone under 21 years old are placed in separate units away from adults. So we are in the study project, we are recruiting participants from reform schools, but also from prisons. And why we started to do this, or why we were interested in this study project, was because when we think about treating detained youth, it's quite common that they have verbal deficits and emotional processing problems, like problems with identifying their feelings or communicating their feelings. They have poor vocabulary and problems in comprehension. So those traditional psychotherapy ways are not so effective for everyone, or the young people with verbal deficits and emotional processing problems are not so motivated for traditional therapy, but they are highly motivated on IT technology. So we thought that maybe if we combine traditional therapy with virtual reality, then we can get the juveniles to be motivated to join the program, because conduct disorders are the most diagnosed psychopathological disorder in detained youth, and it's in contact with recidivism, and it's really important to try to get some rehabilitation programs that they really are motivated in, to get to see some change in the behavior. And we know from previous research that when we use virtual reality for mental health interventions, it has been shown to be quite effective for example, social phobias and things like that, because it's effective because the subjective, the immersion, the presence in the virtual reality is so strong that it evokes so many emotional responses, and it's possible to train the new the new skills anytime and anywhere we kind of want. It's possible for us to create a safe environment for juveniles to experience these, for example, physically dangerous situations that they need to exposure to learn new skills. So it's easy to use the VR technology because of the possibilities to stop at any time and try as many times as you need, and possibility to practice basically anywhere at any time you want. So it's really it has been shown to be really effective. And if we think about treating psychopaths that we heard previously from Chelsea Darby, it's quite debated that whether the psychopathic traits are treatable or not. But actually, there are not so many studies that have really tested the efficacy of some intervention programs in reducing the psychopathic traits. So what I have learned from previous studies is actually that there might be some maybe significant changes in the youth and their way of behavior and in their peer relationships with different kind of psychotherapeutic or therapeutic models. For example, in functional family therapy, where you give some kind of strength-focused counseling to the whole whole family, and other kinds of therapeutic models that have been proven to be quite effective. And considering the high risk for these detained youth to reoffend if they have these psychopathic traits or these callous unemotional traits, it's quite high risk for them to reoffend. So there is really actually quite high need for further studies for different kind of therapeutic models. So that's why we are bringing to Finland or studying compassion-focused therapy, which was which is developed by Paul Gilbert and his colleagues in previous 10 to 20 years. And it has been shown to be quite helpful for, particularly for people who have severe mental health problems, especially those who have high levels of shame. And if we think about personality disorders and antisocial personality disorder and psychopathic traits, it actually goes back to the attachment relationships and how they have affected us, the development of how we see ourselves and how we see others, if we see ourselves as worthy or unworthy of care and support, or if we see others as caring and available, or threatening and unavailable person. So it's the early attachment relationships quite kind of model the way that we see the world, if we see the world threatening or not, if we see ourselves worthy or not. So if we think about personality disorders and antisocial personality disorder, there's a quite big a part of that goes back to the shame and self-criticism. So over the past, 15, 20 years, there have been quite increasing research interest in linking compassion and prosocial behavior, or linking compassion, trying to affect the behavior to get it to mold it for a more prosocial way. So when we were going through different kind of therapeutic models to see what would be really effective for these young prisoners, we came across this compassion-focused therapy model, which was created in Portugal by Diana Ribeiro da Silva and Daniel Rijo. They had made 20 session CFT program with Paul Gilbert for young offenders with these callous unemotional traits and conduct disorders, and their aims were actually to connect the compassion with motives and aims, to see to help the young offenders to see how compassion helps to achieve their plans, and another aim was to provide psychoeducation about the social basis or the evolutive basis of the brain function and the actions and emotions. And they got quite amazing results. These Portuguese studies, they found that giving 20 sessions CFT to these young offenders, it actually increased the compassion towards others and increased also self-compassion, and by that it decreased the conduct problems. And the results lasted for 6 months in 6-month follow-up. So they were quite promising results, and that's why we thought that we should bring this model to Finland. And now that we have in prisons we have this virtual reality good experience with virtual reality. So we tried to, or started to think that maybe we should combine these two elements to see how it works. So what we are doing is we are giving the VR assisted compassion focused therapy for these juveniles from 15 to 20 years old, and to see if it has some kind of effects on their compassion towards themselves and others, and if it decreases the conduct problems like we think it might do. I have some photos of the VR sessions, if I only know how to. As it says, this is the threat system. So the core idea of compassion focused therapy is that humans have evolved 3 emotion regulation systems, which is one is the threat system, which is for protection. One is the drive system, and one is for one is the soothing system. So we have made these VR exposures like in line with these three systems. So this is the threat system. There are some prison theater actors that are, how to say, acting in the videos. They are the videos that get you feel social shame. And then if you go to the next slide, there are some we have some videos for the soothing system, something walking on the ice or walking in the forest, or videos like that affect your soothing system or help you to soothe. And then the next slide. This is the drive system. So we also have videos and VR assisted games for the participants to play, so that they will stay motivated and excited. So all the VR exposure sessions include all these 3 kind of parts of the emotion regulation systems. So this is basically what we're going to do. The study phase starts. We are now recruiting the participants, and the study phase is about to start in August, and then we get to see how this model really works and what kind of results we get from there. And this last slide is why we do this for. This is the key idea, or the take-home message for everyone to, how to say, to make sure that we always remember why we do this, that the kids are not behaving badly because they are somehow bad, but they are behaving that way because they have had problematic backgrounds. So this is actually everything that I was about to present. But if we want to continue chatting and talking about these concepts that I'm more than happy to continue.
Is it okay if I now join the conversation, because it's a very fascinating
Yes.
approach? And I suppose my first question is, what's the reaction been like on an informal level?
For the study project or for VR in general?
Yeah. The people that you've worked with, what's that felt like? Have they taken to, embraced it? Because there's a novelty factor with anything like this initially. I think, Pia, you're frozen for a moment, and your audio might just be a bit broken up, but it'll either correct itself, or if you rejoin, that might help. Jenni, if you want to, what's that reaction felt like?
The VR itself, in the use of VR in prisons has got really, really positive feedback from the prisoners and also from the staff, and everyone are quite, of course, how to say, like the novelty effect that you said. It's quite true that everyone are quite interested and excited about this kind of new technology to be used in this kind of settings. And also this study project that I'm working in, it has got quite excited feedback at that point, but let's see how this continues.
And the organizations embrace this. I mean, again, the natural skeptic says that this is about efficiency, and it's about reducing time in travel between therapy sessions and all of the things that take a lot of time and effort to organize. And this just means that somebody can sit with, and do a managed. Is there a separate and clear, distinct benefit? Do you think, is that what you're trying to establish with the study at this point, or is it, is it being driven by cost cutting as often happens?
Actually, this study project is driven by the fact that young people are actually in the strategic focus point of the prison, the sanction system in Finland, because we have young people crime rates have been increasing, and there are a street gang phenomenon in Finland and things like that. So the prison sanction system is quite motivated for everything that is about youth and about recidivism and trying to affect that. So I think there's also, of course, the cost effect points of view, but also the bigger picture about the young people crime rates. And
do you think this can be so the model? Because one of the things that's emerged from the conversation, certainly we've had today, and listened to so many discussions today about the internationalization of the process for criminal justice, supervision, probation, punishment, all of these things, is that we're entering into, with the technology that we've got, so you can apply. I mean, it was interesting with the photographs that you showed. Are they particularly going for a walk in the ice? Is very either Alaskan or Northern European, North American, and it's. But can this be applied easily in other places, or is there something that you would say would be socially and culturally specific to Finland, or is this something which maybe can be more generic and applied in other places?
Yeah, I think that maybe walking on the thin ice is only soothing for Finnish people, but I think that absolutely can be modeled to, and we also have different kind of videos for the soothing system, not only those ones where we walk on the thin ice, but actually I don't think that there are so many problems to do it in to make it international, or to I'm losing my words, to make it useful also in other parts of the world, because the compassion focused therapy, all the studies of that about the emotion regulation systems, the threat system, the soothing system, and the drive system, they are actually not culturally dependable, or how to say. Yep. So if we just change the videos for different kinds of
I'm just going to bring in Pia, because Pia, we lost you for a moment, and I'm not sure whether we've lost you again, because you again seem frozen. Can you hear us? I'm going to just thank Jenni and Pia. Thank you so much for taking part in this, and it is very fascinating. I'm really sorry we didn't get to ask more questions about it.
You have been listening to the IN-CJ podcast, Conversations about International Criminal Justice. To find out more, go to our website at criminaljusticenetwork.net, or follow us on Twitter at IN-CJ Network.